I'm Dr. White and this is Diane, and today we're bringing you another home rehab video. We're going to talk about the anterior pec stretch. What in the world is the anterior pec stretch? Anterior means front, and pec or pectoralis is the chest muscle. So we want to work on stretching out the front of the chest, right where it joins with the shoulder. This particular rehab stretch goes hand in hand with the shoulder squeeze, and they work in conjunction to help make sure that your shoulders are nice and tall. Gravity's always trying to pull us down and make us slouch forward, so the anterior pec stretch is going to help make sure we counteract that movement. The first thing we'll do is to come up to the door frame. You want to step right outside the door, place both arms on the frame, and we want to make sure that your arms are at a 90-degree angle to the body. The next step is to make a step forward into the room, and sometimes just a small step is enough. You'll start to feel a stretch right at the very top of the shoulder where it joins with the upper part of the chest. You can drop down slightly, bend your knees, and that'll put an extra strain or extra stretch there. Count to 5 and then relax, and then you can step back out and return to the start position. Take a deep breath and step back in. You can step with the same foot or with the opposite foot if you want to switch it up. And count to 5. You'll feel that same stretch in your shoulder blades and in the front part of the shoulder. If you have some pain when you do this stretch, either in the shoulder itself or in the elbow, if you've ever had a shoulder injury, a rotator cuff problem, and this causes pain, then stop doing this exercise. We might need to modify it, or you might not be doing something exactly right, but let me know and we can make some changes for you if we need to. An alternate way we can do this exercise to get a little extra stress and isolate the shoulder is to do one side at a time. On this one, the start position is the same on this side. We're just not going to raise the other arm, and you'll make a step into the door, and you can bend your knees and drop down on this one, and you can even turn away from your shoulder to get some extra stretch right in that top of that shoulder muscle there. This one will be a really big stretch. You want to count to 5, hold that position, and then relax back to the start position. Check your rehab sheet for the specifics on how often you should do this and how many reps. Typically, we recommend our patients do this 20 repetitions in the morning, 20 repetitions at night, 5 days a week. I'm Dr. White, and this is your anterior pec rehab video.